I'm Kim. I'm a speech therapist, and I decided to make this video because my sister had a baby in January that ended up having a tongue tie, and seeing her go through the steps and helping her made me realize that there's a lot of families out there that don't have a sister as a speech therapist, and this would be very helpful for them to know and help you guys navigate how to get the best care for your baby. When he was born, I went to the hospital. I was super excited. I was an auntie again. And I noticed, his tongue looks a little tied, but I'm gonna stay quiet since my sister mentioned that he latched and he's been eating. She did tell me that he was eating every hour. So I stayed quiet, didn't say much. Well, my sister was having just a really hard time with the feeding schedule. She wanted to have him eat every 3 hours, and it wasn't happening. He was eating every hour. It would take him a while to settle down and finally get a rhythmic pattern of sucking and stopping and breathing, sucking, stopping, and breathing. That's called a rhythmic pattern. And so she went again to her lactation consultant, and usually when you have a child and you decide to breastfeed, a lactation consultant will come in the hospital and make sure that the baby latches, make sure that you understand how to breastfeed your baby, if your nipple is appropriate for the baby to latch, if you need some form of nipple cover that you need to put on because your baby can't latch onto you. They help with all of those things, which is an amazing thing and resource for all the new moms. So she went back to her lactation consultant because, just like all moms, she thought something she was doing was wrong. Well, the lactation consultant confirmed my thoughts and said that he did have a tongue tie. So of course my sister calls me because she knows I work with feeding babies, and she tells me, did you notice this? I confirm it with her, and she starts crying because she felt that she wasn't being a good mom. And first of all, this is difficult to catch unless you are someone that works with feeding therapy or is a lactation consultant or is an ENT, someone in that realm that knows this is not looking so good. You have no idea that this is supposed to look a certain way. So for all the moms listening, take that guilt and throw it out because we don't need that right now. So I kind of gave my sister a pep talk, like, come on, like, you got this. That can be fixed. And so once someone confirms a tongue tie, there's several things that you need to do, or that if you want to, obviously this is something that not all parents decide to do, but especially if your child isn't gaining the weight that it's supposed to, this is very important because remember, the first 12 months of a baby's life is to get big and to gain weight and to be a healthy baby. And so this is very, very important for those kids that are just not gaining the weight. But sometimes you'll get some doctors that don't even mention it because the baby is gaining weight. He may not be in the 50th percentile, but he's gaining weight. And as a mom, you will know when something is wrong. So if you feel that something is wrong, go ahead and ask for a referral. Some doctors have said no, but I think as a parent, you have every right to ask for any referral. So there's two options that you can do. You can either go to an ENT, or you can go to a pediatric dentist. And each one has a different way to approach this. So pediatric dentists usually have to go through training, and they learn how to cut a tongue tie. You guys understand it's the lower part of your tongue, and sometimes it is too attached back here. It is too attached, and when that happens, rhythmic movement that a child should make doesn't have enough range to move, and so they're either working really fast or they're kind of struggling. And so this is why, as a mom, sometimes you might feel like, oh my gosh, like I've been feeding him every hour. It's probably because A, they get really tired, and B, they're not filling up and they fall asleep because they're so tired. So another reason why this is so important to get it looked at. So the difference between both of them is a pediatric dentist uses a laser. And the advantage of using a laser is that there's less bleeding and it heals a lot quicker, which I think for me, that would be my choice. A lot of the times though, this isn't covered by the insurance and you do have to pay out of pocket. The prices that I've seen have ranged. Some have been from $350 to up to $645. So it's very dependent. For my sister specifically, her insurance paid most of it, which I have never heard of. So she has an amazing insurance. And a lot of parents are not able to go that route. So the second option is an ENT. Now in ENT, the ones that I have personally worked with don't use a laser. They will use surgical scissors, and that's how they are going to fix that. Now there's more bleeding and it does take a lot longer for it to heal. What happens after this? Is your baby going to latch right away? Is it gonna be magical and the child is going to gain all this weight? Yes and no. So for my sister, the baby took maybe like 2 days to get it 100%. And that to me was amazing, because I don't think I've only had a few babies that has happened, which is fine. As you can see here, my nephew is still trying to get the hang of it. Sometimes is latching and sucking and then kind of gets distracted, but he will eventually get there. She didn't have to go and find a feeding speech therapist to help her get the baby to eat. And so once you're done with the procedure, the dentist or the ENT is going to give you a page of exercises to do. Now these exercises are just so that the tongue doesn't reattach, because there is a chance that the tongue can reattach and you have to go again. And so these exercises are specific for that. They are not for your baby to learn how to suckle. Now, for some babies that have had very, very severe tongue ties, they don't know how to eat appropriately. And so it's kind of like being born again, literally, because they're having to learn how to do this again. And so for some babies, it takes a long time, and that's okay. You already got the most important thing done, which is getting that tongue tie fixed. Which sometimes, I forgot to mention, babies will also have a lip tie, which is up here. And even that, it also makes it hard for the baby to latch onto a nipple and make that movement. Because remember, that lip is what closes the area around the nipple and makes that suction possible. So if they have a tongue tie, sometimes that's going to be hard for them to latch appropriately, and they might have really tight lips. So when you feel it, it feels really, really, really tight. So that's also something that you should look for. What about all the moms that can't get this baby to eat after the procedure? And first of all, don't panic. There's people out there to help you. So if you have insurance, look at the back of your insurance and call and see what are all the providers of speech or occupational therapy around your area. And I will say this, not all speech therapists work on feeding, and not all occupational therapists work on feeding. So when you call a clinic, make sure that you ask for their feeding therapist. It could be either or. One is not better than the other. It just depends on their training and if they like doing that sort of thing, which in my case, I love doing it. So once you get that going, and get the referral. Make sure, like I said, that this therapist is a feeding therapist. I cannot stress that enough. We are not all made equally. Not all of us train and like all the stuff that our field involves. So I just want to emphasize on that, and get that feeding therapist in. Now, in the meantime, you don't know what to do. This is where you go to the doctor and make sure that baby's being weighed in, and keep trying, don't give up, because the minute you give up, this baby can lose a lot of weight. And so video helps for some moms out there that kind of feel that breastfeeding has been very difficult and they're not sure what's going on. And like I said, look for that rhythmic pattern. You know, the baby is settled, he is sucking right and taking his pauses and breathing and then starting again. If that doesn't seem like something that your baby's doing and you're producing all this milk, go ahead and do that. Now, like I said, not all doctors are going to give you that referral if the baby is within weight, but you demand that referral, because as a parent, you see your child every day and you know when something is wrong. The doctor may not see him every day. They don't know what you guys go through every day. And so please don't be scared and ask for those referrals. So I hope this video helps everyone that's out there. If you have any questions, please leave your comments down below and I'll try to get to you. I hope you continue watching, and I hope this video was helpful to y'all.